Days after the new COVID-19 variant Omicron was identified by South Africa, several countries have been closing their borders to travelers from Southern Africa. Uganda, on the other hand, has decided to keep its border open despite the scare. While addressing journalists today on the COVID-19 situation in the country, Health Minister Dr. Ruth Aceng announced interventions to curb the variant if it surfaces in the country. But the Shadow Minister for Health, Timothy Butua, disagrees with the government response to the Omicron variant.
All incoming passengers at Entebbe International Airport will continue. However, passengers will be allowed to proceed to their destination once their sample has been removed. We believe that the daily average of 6 cases is still a manageable number that our surveillance teams can easily track and follow up.
We demanded mandatory testing and that whoever is tested stays at the airport until a negative result is communicated. And it's only that passenger with a negative test that is allowed to proceed to his or her destination. However, we feel for the passengers that they should not delay at the airport, and for that, we ask the minister to multiply the gene expert machines that do the PCR tests such that there is little delay at the airport.
One of the interventions to curb the spread of the Omicron variant include managing travelers entering and leaving the country, particularly at Entebbe International Airport and high-volume border points. Minister Aceng says at the moment, the country has not detected the Omicron variant.
He's coordinating a large number of researchers across the world to better understand the Omicron. Studies currently underway include assessment of transmissibility, severity of infection, performance of current available vaccines, performance of available COVID-19 diagnostic tests, and effectiveness of treatments.
To develop a red list. This is a list of countries that are known to be having the Omicron variant, and this will enable us to do two things. There are two alternatives. We can either deny passengers from those countries entry into our country, number one. Number two, if that doesn't allow, maybe because of our diplomacy regulations, we can now maybe, institute a policy that seeks to do mandatory testing and mandatory quarantine.
The minister has appealed to the general public to embrace and take seriously the ongoing COVID-19 vaccination exercise as the best strategy for the country. The chairperson of the scientific committee says at the moment, booster jabs are not needed.
It becomes a difficult thing in terms of public health to encourage people who have gotten a second dose to go for a third dose when there are people who have not gotten a first dose. So the policy direction will come as the number of people who have received a second dose increase.
A representative from the Center for Disease Control has urged Uganda to continue genomic sequencing, as well as urging the public to get fully vaccinated.
Getting that second dose to be fully vaccinated is probably one of the best strategies that we have right now. And we all learned of this information late last week. So we're certainly still learning many things about this particular variant.
Currently, Uganda has received a total of over 17 million doses through donations and direct procurement by the government, of which over 10 million have been distributed countrywide, and the distribution of the remaining over 6 million doses is ongoing. The world is on high alert as more countries confirm their first cases of the Omicron variant, including the Netherlands, United Kingdom, Zimbabwe, Namibia, Eswatini, and many others. Story by Shamim Natebwa for CTV PM Edition.